These days, there is a lot of information out there, factual and misinformation, when it comes to weight loss medications. Friends and neighbors may be sharing their experiences for what worked for them, but what worked for them may not be right for you, based on your own personal biology, as well as your own medical background and family history. So, understandably, GLP-1 receptor type of medications like semaglutide and tirzepatide, also known as Wegovy and Zepbound, or Ozempic and Mounjaro, have been in the news, all over social media, and there's lots of people using these medications. Many of them are having great success, while you may not know that 10% of people do not actually respond to GLP-1 medications. These medications have been revolutionary in helping to treat diabetes and to even treat obesity, which is why they're FDA approved under the name Wegovy and Zepbound for that purpose. But there are also people using compounded versions, which can be mixed in terms of efficacy, and safety is always a concern. So when you're navigating using these medications, being properly supervised to ensure that you're not having terrible side effects that are affecting your life, as well as losing muscle. This is a very common problem, and in the studies done on these medications, people do lose significant amounts of muscle. So it's very important that you're being monitored and counseled appropriately for your diet and your weight training program so that you are not losing muscle, because in the end, your maintenance and your overall health depends upon you losing selectively body fat and maintaining as much of your skeletal muscle as possible. So in addition to being monitored for side effects and muscle loss, you also want to make sure that these medications are effective for you. Because in the studies, 10% of people did not respond to GLP-1 medications, it's really important for you to know that we do have alternative medications to help with weight loss, also known as anti-obesity medications. These medications are not injectable, but are oral medications and are FDA approved for weight management. Of course, a personal medical evaluation, history, as well as ensuring that you tolerate the medications in terms of side effects and to ensure that they're effective for you are a very crucial part of our treatment plan when we work with patients. Our unique medical approach and lifestyle coaching approach is very effective in helping to partner with you for not only the weight loss phase, but also for maintenance. I'm a board-certified internal medicine, obesity, and lifestyle medicine physician and a culinary coach. Under my direction, our team is here to help partner with you to help you achieve effective weight loss that is sustainable for the long term.